Give the call to the member for Werriwa.
Thank you, Mr Speaker. My question is to the Minister for Health. How is the Albanese Labor Government cheaper medicines policy helping Australians lead healthier lives? What obstacles has the government faced in delivering this cost of living measure?
Order. Order. The Minister for Climate Change. When the House— I don't know what's going on over there, but when the House comes to order, the Treasurer will cease ejecting. I want silence in the House so I can hear from the Minister for Health and Aged Care.
Thank you, Speaker. I thank the Deputy Government Whip and the member for Werriwa for her question, because she promised her community cheaper medicines, and we're already delivering on that promise. Just last July, Mr Speaker, we capped the amount, slashed the amount that pensioners and concession card holders would pay for all of their medicines needs across a given year by 25% to just $5 per week over any given year. And, Mr Speaker, to the end of June, 450,000 more pensioners and concession card holders had already qualified for free medicines for the remainder of 2023 than had qualified at the same time last year. 450,000. On January 1st, we delivered the biggest cut to the price of medicines in the 75-year history of the PBS, slashing the maximum payment from $42 a script to just $30, and I can inform the House, Mr Speaker, that in just the first 8 months of that measure, $160 million has been saved. That's $160 million back into the pockets of hard-working Australians during a global cost of living shock. And of course, Mr Speaker, on the 1st of September, almost 4 million Australians qualified for 60-day scripts for around 100 common medicines used to treat a range of ongoing health conditions. 2 scripts for the price of 1, effectively halving the cost of those medicines for almost 4 million Australians, and 2 million more Australians will qualify for 60-day scripts next year, Mr Speaker. Good for the hip pocket and good for their health. And, Mr Speaker, we continue to put more and more medicines onto the PBS. This month we listed 2 new cutting-edge, life-saving medicines used to treat the blood cancers, lymphoma and leukemia, Onureg and Brukinsa. Before this listing, Mr Speaker, patients would have had to pay $100,000 and $150,000 respectively just for 1 course of treatment. But after this listing, around 1,500 patients will be able to access this treatment at just $30 a script. Now, mother of 3, Skye Hollingworth, had recently had intensive chemotherapy for acute myeloid leukemia, or AML. Happily, she's in remission, but unfortunately AML often comes back to bite the patient again. With the listing of Onureg, she now has a much better chance of continuing to live cancer-free. And she said this, Mr Speaker: "It is incredibly important for peace of mind that something is working on my body so I don't need to go through this again." Mr Speaker, cheaper medicines truly does change people's lives.